Hi everybody, my name is Marie Therese Carmela Aguilar and I'm a final year nursing student at Australian Catholic University, Melbourne. Today I will be presenting my guide for nursing managers at a local health district for my NRSU 371 presentation. My presentation is entitled Nurses Making a Change Vaping Among the Youth. This presentation will discuss the nurses' role in vape prevention and improve health outcomes for the youth. Nurses can play a pivotal role in preventing the prevalence of vaping among the youth based on their scope of practice, knowledge, and experience as mentioned below. Here I will discuss the role of the nurse in raising awareness, conducting risk assessments, providing education to caregivers, and collaborating with multidisciplinary teams in the community to address prevalence of vaping among 12 to 18-year-olds. In raising awareness based on their line of work, nurses most likely have seen the detrimental effects of vaping firsthand. Therefore, they are expected and most likely to be knowledgeable about the effects of e-cigarettes. Nurses can advocate for e-cigarette cessation and prevention programs in a school setting by partnering with educators and administrators. For instance, school nurses can raise awareness among the youth through advocacy of accurate education of the potential consequences of vaping, provision of cessation resources, and supporting students. Moreover, nurses' role is not only limited to caring for the sick, but they can also speak up for the vulnerable population, such as the youth who vape. An example of nurses bringing about awareness regarding vape use can simply be posting media from the Give Up for Good campaign, which is visible to many of the youth online. In conducting risk assessments, nurses are trained in assessing their patients' physical, psychological, sociological, and spiritual needs. In the context of vaping among the youth, identifying patients who smoke and aiding them to quit the act is within the nurse's scope of practice. Nurses and the allied health can use the Ask, Advise, and Help model to identify smokers by asking, persuade smokers to quit by advising, and assisting smokers through interventions by helping. Nurses can also use a variety of screening tools, such as the Time to First Vape screening test, the Modified Hooked on Nicotine checklist, and the Penn State e-cigarette dependence index, to assess their young patients' needs and provide them relevant and appropriate nursing interventions. For instance, the Penn State e-cigarette dependence index can assess a patient's symptoms in relation to nicotine independence. Therefore, if a patient is assessed to be highly dependent, the nurses can think of appropriate behavioral interventions instead of interventions and resources catered towards low dependency smokers. For providing education to caregivers, one of the nurses' roles are being educators. Nurses also play an important role in discharge planning, including providing discharge education to patients and their caregivers. According to the Royal Children's Hospital Melbourne's Child Health Poll number 17, 40% of the parents are unaware that vaping can cause death from its complications, while 37% are under the false impression that it is a safe device to help users quit. Therefore, in this scenario, nurses should make effort in educating family members, guardians, caregivers, and even peers about the devastating effects of vaping from a young age to increase their health literacy regarding vaping and improve health outcomes for the youth. An example of this would be informing family or peers of a young patient that vapes are not proven to be healthier alternatives to tobacco smoking and can still cause long-term health risks. In collaborating with the multidisciplinary teams in the community, nurses often collaborate with the multidisciplinary teams to provide high quality individualized care plans for their patients. With the vaping situation among the youth, nurses can educate and work with stakeholders, such as policymakers, on public health strategies to combat e cigarette use in the youth. Furthermore, primary care nurses can also utilize pharmacotherapy, such as nicotine replacement therapy, and behavioral interventions, which requires the assistance and expertise of a doctor, pharmacist, and psychologist or psychiatrist, respectfully. For instance, young patients whose diets have been affected by vaping would most likely need a dietitian referral done by the nurse to ensure a healthy diet plan is implemented for them. In this section, I will be talking about the recommendations for nurses in enhancing their role in reducing the health effects of vaping among the youth. This section will tackle unique challenges and opportunities in implementing preventive measures, engaging communities, and advocating for policies, which is done by the nurses. In reducing the health threats of vaping among adolescents ages 12 to 18, there will be opportunities and challenges encountered by nurses, as vaping among the youth in the present time is an increasing health problem in Australia. So for this section, as you can see, I have created a mini infographic on your screen, and I will be using this illustration to tackle the key points I want to point out in this part. So let us now begin on to your left with implementing preventive measures. So in implementing preventive measures, challenges to this would be lack of knowledge or training. A study reported of a gap among healthcare professionals' clinical skills in addressing e-cigarette prevention and cessation. Therefore, nurses must find opportunities to engage in nursing research to gain the knowledge and skills necessary in clinical decision making for young vape users. In the middle, in engaging with communities, a common barrier experienced by nurses would be unmotivated clients due to complex care demands. The nurse can utilize motivational interviewing to influence greater quitting outcomes. Motivational interviewing can be effective as it fosters empathy, acceptance, and person centeredness, which promotes better treatment adherence and compliance. And on to your right, which is the last one, in advocating for policy, a barrier to this would be lack of research, such as the unknown long term effects of vaping. As the multidisciplinary team plays a vital role in smoking prevention, it is essential that nurses collaborate with the multidisciplinary team in the provision and development of evidence based advice and interventions which empowers the youth to quit vaping while also advocating for change through reforms and policies with the government. So thank you, nursing managers, for your time. I hope you've learned a lot from my presentation, and I hope it is applicable and helpful to the communities you belong. So once again, I am Marie Therese Carmela Aguilar, and this is my NRSG 371 Building Healthy Communities presentation for my assessment task number 1. The slides after this will be the references that are only found in this video. My full reference list would be on my sway. Thank you.